Thanks a lot, Topista. Again, hello everyone. It's great to be with you today as we meet to discuss about the designing of the research plan. This is our third webinar for the 2025 in English, our third webinar in English. And I would like to welcome everyone on behalf of APHRC and also on behalf of the the African Research Support Hub program team. And I think we can start off now. I would like to start with a small presentation just to have us understand the objective of the webinar and why we are prioritizing it and how it is linked to the African Research Support Hub. And then after that presentation, I will have the opportunity to introduce to you the speaker of today, Dr. Caroline Kabilu. I will share my screen. This is the technical problem. So I was saying that I'm going to just talk about a little bit about the African Research Support Hub program, and then as I talk about today's topic on designing such a robust research plan, I will also take that opportunity to introduce today's speaker of the webinar. So this African Research Support Hub program, which is organizing this series of webinars, is a collaboration between welcoming the African Population Health Research Center. This is an initiative that was designed to strengthen the capacities of R&D medical researchers across sub-Saharan Africa to develop or to focus on discovery research, grant writing, and fundraising. This is because there is evidence that African researchers are not enough competitive enough they are not competitive enough when they submit their research proposals to international funders, and we have very limited funding from our governments whose contribution is not yet has not yet reached even 1% of their GDP. So this initiative is intended to boost the way African researchers compete for international research grant funding. So it is started in 2024, and it's expected to last for 3 years. And it was largely inspired by the program that we have here at APHRC. It's called Kata program. It was because it has a big component of capacity development for African researchers. It was this program, ARSH program, was largely inspired by the Kata platforms. Yeah, the overall objective of the program is to create an Africa-centric research support hub, which is hosted in APHRC, but we also have the plans to develop other regional satellite hubs to support regions in Africa, in East Africa, Western and Central Africa, in Southern Africa, to make sure that we have the full reach across Africa. So, yeah, this is one of our specific objectives. So then, the other overall objective is to make sure that we capacitate our R&D medical researchers to have skills that can allow them to develop or conceptualize discovery research grants proposals and successfully fundraise for them. And then that specific objective is to still continue building the capacities of R&D medical researchers in Africa, and also to create a mentorship program, because we've seen that most of R&D medical researchers in Africa, they don't have mentors. Whenever they have ideas for research, sometimes the ideas cannot be developed to the fullest because they are missing the people who can mentor them. So we were creating a mentorship program where R&D medical research can interact with mentors, and they are able to develop the research ideas that they have in their minds. And to still improve the way African and medical researchers conduct research, we thought that it would be good to develop a community of practice for networking, because this is one of the ways to ensure that the researchers do not just stay with themselves. They are opened up with other collaborations, and they have the opportunity to know what is happening in the other parts of Africa, but also in the global, to network and be able to develop research grant proposals for international funding. This program is intentional in including French-speaking researchers, as we're going to see in the next slide. Because we are targeting our audience includes all early and mid-career researchers. We think about the postgraduate and the pre-doctoral researchers, but also postdoctoral researchers. And the way we reach our career researchers who are postgraduates and pre-doctoral researchers, we use Virtual Learning Academy, the monthly webinars like this one that we are having today. We also develop the self-paced training courses where people can train themselves on grant writing, free of charge. We are making this free because we've seen most of grant writing courses. People have to pay money, but for the benefit of our medical researchers in Africa, we are making this free for people to run or to run different concepts on how to write grant proposals and fundraise for their research projects. We also have some facilitated training courses online, and also the community of practice, as I was mentioning. This Virtual Learning Academy is not limited to pre-doctoral and postgraduate researchers, but also for postdoctoral researchers who don't have the opportunity to be recruited into our mentorship program. This mentorship program, it's happening in the region that I've mentioned, because we think that if people are mentored, they can take further their research proposals. So within each region that I have mentioned, East Africa, Southern Africa, West and Central Africa, we are creating regional satellite stations where we recruit about 25 postdoctoral researchers. And we train them. We train them for 1 week on grant writing, and also we support them. We match them with the mentors for 12 months to be able to develop their research project into bigger research grant proposals. So that's the difference. This one, this other component, this one of postdoctoral researchers, we focus a lot on the mentorship program. Yeah, as I said, it's about our monthly webinars, which we have them monthly in French and English. And this year, 2025, we have already had the webinars in February and March, and this month we are having the webinar this is the webinar, the 2 webinars in French and English. This month theme is about designing a robust research plan. And the goal is to understand the methodology and approach to develop this research plan. And Dr. Caroline will talk more about that. And allow me also to introduce her so that I get the opportunity to give her the floor so that she takes us through what she has prepared for us today. Yes, I think I've mentioned about the aim of today's theme for the webinar, which is to understand the methodology and approach to design a robust research plan, project timelines, and milestones, also including the risk management. Yes, our speaker today is Dr. Caroline Kabiru. She works with the APHRC, where she leads the unit for sexual, reproductive, maternal, newborn children, and adolescent health unit. And she has a background in public health and health promotion and behavior. PhD she obtained from the University of Georgia, from the United States of America. She has an extensive experience as a senior technical advisor from the DFID Fund Evidence to End Female Genital Mutilation Research Program. She has also over 15 years of experience in Sub-Saharan Africa research, especially in the key areas like youth and health well-being, sexual and reproductive health, mental health, urban low resource, and marginalized settings. And she has developed a strong interest in research capacity development, and that's why we have invited her today, so that she can take us through how to design a robust research plan for grant proposal. So I will not take much time of how this, because this is her time to take us through what she has prepared for us today. So, Dr. Caroline, please feel free to talk to the audience today. Thank you.
Thank you so much, Alpio, for that overview and for the introduction. It's a pleasure to be here with all of you. And I'm looking forward to the conversations that we'll have. And I'm very curious, maybe if we just jot down in the chat, I hope the chat is accessible to everyone, what we think goes into a research plan and why we think it's valuable. So if you could just jot down and we'll read a few and then I can begin presenting. But I hope everyone has access to the chat. Thanks. So maybe if we could just get a few thoughts on chat about what is a research plan and why we think it's valuable. Okay, so the chat is disabled, unfortunately. Okay, then no worries. Then I'll just speak to it, and just to say that in preparing for this conversation, I went online just to see, I mean, what do people describe as a research plan? And sure, in this case, it's being discussed in the context of proposal development. But I thought it would be valuable also just to speak about it from the perspective of, yes, what happens once you've obtained your grant and you need to implement a project. So in terms of the content, it can very much go into the research plan component of a proposal, but also it can be part of what others might call a research protocol or a plan that guides you in terms of the research. And Topista, please let me know if my presentation has a shadow.
No, it's fine. And just to note, they can also,
yeah,
they can also answer using the Q&A function. That is where they can post their questions.
Okay, thank you. Okay, so in terms of the content of this presentation, I'll go over what is a research plan, why is it valuable, what is in a research plan, and then how do we implement the research plan. So like I said, I decided to both look at content that would go into a research plan part of a proposal, but also once you get the funding, how do you implement your research in a systematic manner? Because ultimately, even implementing a project in a systematic manner where you're documenting things is part of financial sustainability, because it shows you can implement a project well and it then prepares you for further funding. So what is the research plan? And so there are different aspects if you go online that will tell you about a research plan, but essentially it's really a blueprint or roadmap that details the project's aims, goals, methods, and logistics. And it helps ensure that research is organized and systematic. Or if it's in a proposal, you're really showing that you've thought through the process in a systematic manner. It helps keeps the research focused once you receive the money, and also ensures that the research team is on the same page with respect to the project's aims, but also how it's going to be implemented. So what's in a research plan, whether for a proposal or as part of a research protocol for implementation of a project, it will describe the study methods in adequate details that others can easily pick up what you've written and replicate the work. It outlines the ethical considerations that will ensure responsible conduct of research. It includes a risk assessment that ensures that the research team is proactively thinking about potential challenges and how they would respond to those challenges, so the mitigation plans. And I think that was one of the aspects that was highlighted in the slides that Alpio presented. And then it describes the research team's expertise. Whoever is reading the research plan, or even if it's for the team itself, is really understanding that the team has the necessary human resources to implement the project and to do it well. And then it describes how the research processes will be managed. Importantly, describes how the research findings will be shared and communicated. And for us who work at APHRC, where our vision is really that lives in Africa are transformed through research, we really need to think about how the research that we are undertaking gets into the hands of those who can actually use it, either to design policies or programs that will improve lives, in other words, transform them. And then also it ensures that resources needed are appropriately allocated and identified. And then it includes a timeline so that the research staff can stay on schedule. But if it's for a proposal, that you're really showing that you've thought through the timeline that it will take to implement the project within the project timeframe. So in terms of what is in a research plan, very much mirrors what might be in a research protocol that you're submitting for ethics approval. But also when you're developing a proposal, you'll probably speak to each of these aspects. The introduction and background, where you're setting the scene for this work. Why is this work important? Others have been in the field working on issues. What are you adding to that? A good friend of mine describes the introduction and background as that step where you're saying you've entered a room, there's a conversation going on, you listen to the conversation and then figure out where you can chip in to expand the conversation and improve the conversation. And then what are the study objectives? What are the methods that you'll use? Again, the ethical consideration, the team, the project management, the research communication, the budget, and the timeline. And so in the next slide, I just take a slide for each of these so that we go through the content. And again, if you have questions, please post them in the Q&A and we can come to them. So in terms of the introduction, what one is hoping to do in this section, the introduction and background, is to summarize the significance of the proposed study. So really, why is it important to undertake this study? What does it add to the existing literature? So in this section, you're also as well summarizing the existing literature on the topic. And this is not perhaps what you do for a PhD thesis or a dissertation where it's an entire chapter. You're really trying to take that chapter into a few paragraphs where you're summarizing what are the key points in terms of the literature. It's also helpful depending, of course, on the leaning or the orientation of the study to describe the theoretical underpinnings. How do you see the concepts or issues that you're being connected? Is there a theoretical framework? Is there a conceptual framework? And again, just explaining how the study builds on and expands existing research. Some will talk about a research gap. But really, it's what are you contributing? In some cases, you could actually be replicating a study, and it's to expand perhaps the settings in which a study has been conducted. Then you also want to describe the research questions and study objectives. And I thought it might be useful, again, just to think about what is a good research question. I'll share the slides after this. And Monash University has a really good website where they discuss developing research questions, and it includes an interactive quiz as well that enables you they sort of share 3 iterations of a question, and you pick which is the best framing of the research question. But essentially, a good research question is clear and focused. So it must be direct and specify the required task. Often I would say that when you read a research question, you can almost imagine what the methods might be like. And if you can't, then maybe ask whether the question is clear and focused. It has an appropriate scope. It's not too broad or too narrow, because you want to show that really you have some depth to the scope of work that you're envisioning. So you want your research question not to be too broad that you can't answer it. What are the effects of climate change on the world? But you also don't want it to be too narrow. It should be complex, and it should avoid a simple yes or no answer. Or on the other hand, it shouldn't be overly difficult, that it would be difficult anyway to understand or to even conduct a study to answer it. And it has to be researchable and answerable using the available resources, including time. And then finally, it should be an analytical questions that allows for analysis of an issue and not a description. And again, I encourage you to go to the Monash University website through the link and just see how they frame research questions if you feel that you need more guidance in terms of that. Then there's the methods, which is perhaps the most extensive because there's a lot of information that's going. Sometimes, depending if you're working on a proposal, then you might need to be succinct, especially for the Wellcome Trust, for example, where you don't have a lot of leeway in terms of their number of words. But there are certain aspects you want to make sure that you're speaking to. What is the study design? Is it an RCT? Is it a qualitative study of a particular type? Describe the study settings. Where are you going to be conducting the study, and why is it useful to conduct the study in that particular setting? Describe the research methods that you'll use to meet your objective. And so this might be that it will include structured interviews, that will be done one-on-one, perhaps because it's a sensitive topic. You might be using other methods like self-interview and that sort of thing, participant observation, whatever method is relevant to the question that you're hoping to answer. And then describe the research participants. And sometimes you have a study where you will be interviewing multiple groups or engaging with multiple groups of researchers or rather participants. So for example, you might have interviews with adolescents, and you also want to interview caregivers, and you also want to interview other people like teachers who are in the community, health providers. And so it's important to describe each participant and how they will be involved in the study. And it's good as well to include the inclusion and exclusion criteria. And so inclusion criteria is what attributes someone must meet to be a member of to be a participant in the study. So it might be that they have to be an adolescent mother who is aged 15 to 19 and who has a child, 1 to 3. Now, the exclusion criteria, because sometimes we see that there's a confusion where one assumes then the exclusion criteria is anyone that doesn't meet the inclusion criteria. That is, they are an adolescent father, they are aged 10 to 14, that sort of thing. But really, the exclusion criteria should be that person who meets all the inclusion criteria, but has something about them that will limit their participation in the study. So it could be that your study you can only conduct your study in English. And so someone might meet all the other criteria, but they also have to speak the language. And so it's whatever it is that the person they meet the inclusion criteria, but there are aspects that prevent them from participating, or you go and they are inebriated, or they have a disability that would otherwise limit their participation in the study. Then it's important as well to describe the sample size and the sampling process. If it's a quantitative study, you want to show that the sample size would be adequate for the sorts of analysis you plan to conduct. And then you want to describe the study tools and measures. For a proposal, maybe you might not need to include the actual study tools and measures, but if this is a research plan that you're using perhaps as a protocol, then you want to include your study tools in an appendix so that whoever is reviewing it can assess that as well. Then you want to describe the field procedures, including how participants will be recruited, the languages used, the methods of data collection. And then you want to explain how you will handle the data, how you will process it, and then how you'll analyze it. And then finally, it's important to describe any study limitations so that as people are reading your work, they also understand really what are the limits of the approach that you're taking. And that's true for either a proposal or what others might call a research protocol. To move on to ethical considerations, I think for much of the research we may conduct, I don't know the diversity of the people on the call, but assuming that you are conducting research with human participants, then it's important to look into the ethical considerations. How do you ensure that research is not harming your participants or that any risks are minimized? And one aspect of that is being able to describe the informed consent process, how you will ensure that all participants in your study provide informed consent. So they have to be able to understand what the study is about, understand its implications on them, the benefits, the risks, and then to be able to tell you, yes, go ahead. And it's also important to describe whether it will be signed or verbal. For verbal, this will often happen if the risk is really minimum, and perhaps the greatest risk is if someone got a hold of the consent form, and then perhaps there's some stigma or some other retribution that would result from that. In that case, you'll find some ethical approval committees might be willing to give verbal, allow for verbal consent. If you are conducting research with minors or other vulnerable groups, for example, those who are incarcerated, then it's important to describe also how you will involve, get consent both from the participant or assent if it's a minor, as well as consent from a caregiver or legally authorized representatives. And again, if it's a research protocol rather than proposal, a research plan for a proposal, then you want to include the informed consent forms in the appendix. And in our context, often the ethical review committee will want it in all the languages that the interviews or discussions will be held. It's valuable to describe how privacy will be ensured during data collection. Describe any compensation. So will you give people maybe the equivalent of $3, $5 for their time, or perhaps you'll give in kind. And then like in my case, we've worked with adolescents, and in that case, we are not able to give money, but often what we'll do is we'll provide a meal or refreshments. And so describing that sort of compensation. And then describe how the research team will be trained to ensure the ethical conduct of research. And this is true whether it's a research plan in a proposal or a research plan or protocol for an actual project. Just to make sure that everyone is aware that the team has undergone ethical training and is aware about ethics in research. And then describe how data will be handled to ensure anonymity and confidentiality, including how it will be stored or anonymized. And so, for example, if it's interviews with in-depth interviews where you're interviewing and recording, then you want to say what you're going to do. So the recordings will be destroyed immediately after transcription. And not only that, you'll go through the entire transcript. And if someone's name appears or some other aspect that would sort of limit the confidentiality, then all those are removed. And then describe any research risks and discomfort to participants and how these will be minimized. So, for example, if you're conducting a study on mental health, you might be asking people questions that cause a lot of discomfort and could actually trigger a negative experience. And so it's important to describe how those will be minimized and if you have taken any action to ensure that they get help as needed. And then provide details on ethical approvals or permissions to be obtained. So you will get it from a particular IRB, or you'll also need to get research clearance, which is the case for some in some of our countries, where you not only need the ethical approval, but you also need the clearance from a government-approved body. Then it's also important to think about your research team, describing the team's qualifications, their roles, any training, just so that anyone who is reading either the research plan in a proposal or your protocol can assess the personnel's suitability to undertake the research. And some of the critical aspects that you want to highlight are sort of their training and their qualification, any experience working in the study setting, experience with the study population. So-and-so has worked extensively with adolescents, such as the ones we propose to study. And then experience with the proposed research methods, brings strong expertise in randomized control trials, in qualitative research, that sort of thing. Just so that anyone who is reading can say, okay, this is a team that is well suited to undertake this research. And then it's useful to describe how you manage the project. And so this is true whether it's a research plan in a proposal or the research protocol. How will it be managed? Will you have regular meetings to assess progress and to troubleshoot? Or perhaps you'll communicate via email or any other approaches that you'll take to manage the project. And then outline field supervision processes. So in the field, there'll be a supervisor who will double check interviews, who will do, we used to call them shadow interviews. And this was often because once we made the transition to electronic data collection, it might be hard to go back because you don't have the questionnaire necessarily to say, okay, you were asked this question and this is how you responded and that sort of thing. So it's you have two people who attend the same interview and actually collect the same data, then you're able to compare and see where there may be challenges. Perhaps it's in how your team understands certain questions and then you can troubleshoot at the very beginning. And then describe how project documents will be stored. Perhaps this might not be so critical in a proposal, but once you're getting into a project planning phase and describing your protocol, it's useful to think about how you will document how you'll maintain the project documents as part of data documentation, because you really need to show, okay, these were the questionnaires that were used, these were the perhaps this was the budget, this was X, Y, and Z, this is the publication plan, and to have that in a place where other people can get it, but also in a context like us where we're working in an organization, you want to think about others who may come after you might have been the one who was leading the project, then you leave the center, but someone should be able to come and pick up from where you are. So it's important to also think about how you store documents in a way that's accessible to others. I'll move over to the research communication plan. And in some cases, it's also called dissemination. In others, some funders prefer the use of research uptake, just so that it's clear that you're thinking beyond just your current study and how you'll collect the data, but also thinking about how that research will be used. And so in this case, it's really describing how you'll engage key actors during the research process to foster collaboration and to facilitate the use of the research findings. And just from our experience, my experience is the earlier you engage key actors during the research process, the better. If you're really keen to see that your research is being used in either for developing other research programs, for developing intervention programs, perhaps informing policy. The earlier you involve key actors, the more open they are when you actually share the findings. So if they're part of the design of the study, if they're involved in co-creation, if you inform them about the study and what you're hoping to get, then they can already see that, yes, you're considering their thoughts and perspectives even as you design the study. It's important to describe how the research findings will be shared with specific audiences. It might be that you will write peer-reviewed publications for a more scientific or technical audience. You'll also work on blogs, which are common now, newsletter articles, newspaper articles, and even for some, it's just that you'll have a PowerPoint presentation that you'll give perhaps to people in the community. And then also consider using a publication plan. For the projects that I've worked on, a number of them, I've found that it's really valuable, especially when you're working as a team, to think about the key papers that you want to write, and then other manuscripts or products that might come in. And so what I'm showing here is from one of our projects where we had a publication plan. And so really what it lists is, okay, these are the papers that we'll write. This is the person who will be the author. These are the people who will co-author. What sort of paper will it be? Will it be a peer-reviewed publication? When do we plan to submit it? And also now the status is really informing, okay, it's been submitted, it's been accepted, we're working on revisions. But this is also useful because one of, I think, a common challenge in the science field is sort of issues with around authorship and publications. And so if you think about the main papers and who the authors are, and you can even discuss the order and that sort of thing earlier on, before the manuscript is written, I think you can avoid many challenges that come around with authorship. And so for us, we really found this to be a useful tool where we sat down and thought about, okay, in this project period, we see ourselves only perhaps writing 4 because it's heavy on implementation. There are other manuscripts, so if people are interested, then they can include them in the plan. But these are the 4 main papers, and this is who will lead, and these are the people who will contribute. Then there's a budget, which really should outline the project costs in detail. And it's important to provide adequate budget notes to enable a third party to evaluate how responsible or feasible or reasonable the costs are. In my role, I'm asked to review a lot of budgets, perhaps as part of the proposal development process, or perhaps someone is going into the field and he has worked on a budget for the field work. And often, for me, the biggest struggle is when there are no budget notes to explain. So, for example, you might find that, there are conference costs, and then for one group of people, the conference cost is 20. In this one, it's 50. What is the difference? So always think about the person who will be looking at the budget without a lot of detail about the context. So the more you can explain so that it's clear that perhaps we will do the training for fieldwork in a cheaper hotel than the meetings where we will hold, say, meetings with stakeholders, then it's clear why even the unit costs are different. And then once you get the resources, while budgets are in their nature flexible because it's a budget, it's not an actual expenditure report, it's important to keep track and to inform the person who is funding the work of any significant shifts within budget lines. Many times in the grant agreement, it will tell you something like any variance beyond 10%. That you must get approval from the funder. So it's really important to keep track and to inform your funder of any significant shift, because what you don't want is someone to say, I'm not going to pay that because I didn't approve it. So especially if you're getting the money post-implementing. Then sometimes we are very frugal, and perhaps we spend a lot less than we budgeted for. It can be a good thing that perhaps the exchange rate improved significantly and now you're able to buy more with an equivalent, say, amount of dollars or pounds. But spending too little is also a problem because it can suggest that you either overestimated the costs of your research or that you're poorly forecasting your expenditures, and some funders actually look down or have issues with that. And so even for us at the APHRC, we'll often have this conversation about burn rates and being told, you really need to keep your burn rate high. In an organization setting where you're also getting indirect costs, which is a percentage of how much you spend, the better you are at spending, the more the organization is able to recover in terms of indirect costs. So spending too little can also be a problem. And then there's the timeline, which really should list all the project tasks and the estimated duration for each task. It's important to be realistic with the timeframes. Sometimes activities like ethical approval can take several months. So for us, for example, there's a particular ethical approval within a hospital where it can take 6 months. So it also helps you bear in mind whether, say, someone is telling you, please apply for this funding opportunity, but we only have 6 months. And then you see, oh, I have to get ethical approval. It might take the 6 months. So you're saying that I think then we need to be flexible about the project period. So these are some of the things you want to take into account. Be as realistic as possible with the timeframes, and consider whether you're working on this full-time or part-time, because certain tasks might take longer if, say, you're only able to dedicate 20 hours a week versus if you're on a project 40 hours a week. And then for a project that's going to be implemented by a team, for each task, it is helpful to indicate who is responsible for each task. And it also makes sort of managing the project meetings easier, because you can say, okay, so-and-so, where are we with this? So-and-so, where are we with so-and-so task or this and this task? And so people are also aware of what they need to do and can follow up and track progress. So I did want to just end by showing a tool that is available for colleagues at the African Population and Health Research Center to help keep track of implementation and also as part of quality assurance. And Liz, I've seen your hand. I'll hand over just in a little bit. So this is what we call a quality assurance checklist, and it was actually developed under a project that was implemented by Population Council and APHRC, looking at, it was around unintended pregnancy and sexual and reproductive health. And this was a helpful tool for a project team to keep track of, have you undertaken all the steps that are needed? Are you documenting the things in the right place? So where you see EDMS, it means our electronic data management system. So a place where people can archive or store various documents related to projects. And it's really helpful for continuity. And if also you just want to refer to something, then you immediately know where to get to it. So really this checklist, it outlines the project, who the team is, the start date, the end date, and then it has different sections. And the next couple of slides, I'll just show you the different sections. But again, I'll be sharing the slides. And if you have further questions, or if you want a draft of the checklist, I'd be happy to share that as well. So in terms of the design, the protocol, the sampling methods, research question, you want to ask yourself, has a project inception meeting been held? Now, this is assuming you already have the funds and it's a protocol for your work. So have you had a project inception meeting? Who attended? Are there minutes? Then you can say yes, and then archive, say that the documents are stored in this particular folder. Have you taken a risk assessment, and have you outlined the appropriate mitigation measures? Have you developed a research uptake strategy, which can also be considered a research communication plan? Who do you plan to target? What products will you be developing? The frequency and that sort of thing. And again, for each of them, there is the reminder. Archive the document in whatever folder and provide a link here if it's an online folder, that sort of thing. Have you held a stakeholder workshop? Have you developed safeguarding protocols? The research protocol itself, has it been reviewed? Which is important for quality assurance as well. Then has it been reviewed, in this case by our scientific review committee, but whoever is the responsible committee in your institution, have you obtained the ethical approvals, and where are they stored? And what are the dates of approval? What are the numbers and that sort of thing? Then for the implementation, have you developed a manual for your field workers? Have they been trained? Have the tools been pre-tested, translated? Do you have a quality control protocol that's implemented, and any relevant documents? And then even as you implement the project, are you engaging with stakeholders to keep them abreast of where things are? Are you renewing any lapsed approvals and permits? In terms of analysis, are you making sure that every paper, say for example, that is written is reviewed before being submitted? Because we need to think, again, it's a quality assurance checklist as well. So you want to make sure that you're taking all the quality assurance steps to ensure that even the products you develop meet the quality thresholds. Have you held consultations with stakeholders once you found the findings? Are they able to validate the findings? I think personally, I feel like this is an area where as researchers, perhaps we need to do more. We've begun to do more in some of our work with adolescents, for example, where before we finalize the report, we present the findings to young people and we ask them, what are your thoughts on these findings? Do they truly reflect your life? What sorts of recommendations? And I found that, at least in the projects that I've been involved in, has been very enriching, and it sort of ensures that the voices of those who we are working with are actually reflected even in terms of the recommendation. Then we also want to check that all data has been cleaned, anonymized, documented, and archived. That transcripts and field notes have been translated, anonymized, and archived, and where they're archived. And then for the administration is whether there was a grant agreement, the progress reports were submitted as planned, the closeout reports have been submitted as planned. And so really that's the checklist that's available for us in our research governance framework. Again, I'm happy to share it with colleagues who might find that such a checklist would be of value to you. And these are just some resources that I used as I was developing the proposal. And again, I'm happy to share the slides so that you can access each of these resources and also refer to the slides. But I want to end there. Thank everyone for listening, and really looking forward to the conversation. Thank you. So over to you, Alpio.
Thank you so much, Dr. Kayana, for your good presentation and the explanation that you have given how to take all these steps that people need to go through to have a robust research plan. I think it's now time to open up session for questions and answers. So I will ask people to raise hand and ask their questions to you.
We've got some questions on chat as well, on the Q&A.
Yes.
Yeah.
Who wants to go first? Oh, you want to go start with the questions from the chat?
We have Liz. Liz can go first.
Okay.
Liz, please unmute. I don't know if you can hear us, Liz.
Hello, can you hear me?
Yes, now we can hear you.
So I have a question on the budget. Are there where there is not, or rather, where a budget has not been provided, or where one does not know the total budget, are there some rates that, or rather, is there like rates that one can use to make sure that their study does not fall beyond the budget?
Topista, do you want me to answer question by question?
Let me unmute someone else.
And thank you for your question, Liz.
All right, Mika, over to you. Okay, Mika, unless you accept my invitation, you cannot unmute yourself. So, all right, okay. Just give him a minute. There we go. Mika, now ask your question.
Hello, can you hear me?
Yes.
Okay. Thank you so much, Caroline, for having done such kind of a brilliant presentation. Actually, I'm in line of this field of research whereby we usually do the proposal development for consulting, as just as the way the APHRC usually does. Actually, my question emanates around the issues with the budget because we have been doing some applications for the consulting, but then you see the client can call you, ask you the budget, like maybe can you ask you the budget, then you give a tentative budget or exact budget, then after which he or she disappears. So you get now there is that confusion. But then I would like also to know, like perhaps for the types of consulting, because I know we have high-end projects and we have the low-end projects, of course. You know that one, Caroline. Yes. So I don't know, maybe for the high-end project, usually if you apply and you have a strong team, definitely you will win that one. But for the low-end projects like in Kenya, in our market, actually it's very poor because sometimes there is you can even try some lobbying, but then still you can't get it. So perhaps I just wanted to know maybe what criteria mechanism as APHRC do usually employ or perhaps utilize, maybe perhaps in drafting the budget so that it can align with the project. Of course, I am sure the budget is subject to the project scope, the kind of maybe team you have, and also, of course, the output of that project, because you cannot just have a project which is not satisfactory or does not align with the project itself. So perhaps I just wanted to know maybe the budget range, the kind of stuff, because I know sometimes you try even to get client to give you the budget range. He can tell you maybe don't go below this and then go above this one. So I just want maybe perhaps to get some insight on maybe how you personally as Caroline, or maybe how perhaps as APHRC usually approach such kind of thing while drafting the budget. Thank you so much.
Thank you, Mika. I'll get another one from Francis. Just a minute. Francis, you may ask your question. Please unmute.
Hello, can you hear me?
Yes.
Okay, so my question relates to the research objectives. So we've been told that when developing research objectives, you have to avoid having the objectives depending too much on each other. I'm looking at a scenario where I plan to develop a tool, and that tool is later used in subsequent work packages of the same project. How much of a problem is that, and how best can I prevent that being a problem with the funder? So the idea is that I would like to be able to do that without facing the challenges that may arise from putting both the development and the application of the tool in the same application. Thank you.
Thank you, Francis. I'll take two more and then we can go to the chat for the other questions. We have Tim Keta. Please unmute and answer. and ask your question, sorry. Tim, please unmute. We can't hear you. We still can't hear you. Still no. No, not yet. Okay, maybe you can post your question on the Q&A, and then we will read it out. Thank you.
Maybe Topista, we can take maybe only one more so that I'm able to keep. Yeah.
Yes, we are just taking one more. That is Eric. Eric, you're the last person. Please unmute and ask your question.
Okay, thank you so much. Are you able to hear me?
Yes, please go on.
I am Eric Oteba from Uganda, and I really picked interest in this webinar. I was in the center last year, and it was really interesting. Now, in the era of AI, how are we going to, probably manage the researchers? Is it still going to be, the human doing all this, or we can now integrate with the AI systems that we have? Because you realize that there's a lot of utilization of AI, different forms of AI. How are we going to work with the AI world? Because I believe we could benefit in a way. Yeah. Thank you.
All right, thank you, Eric. Over to you, Caroline.
Thank you so much, Liz, Micah, Francis, and Eric. And I hope, Nketa, you're able to share your question via chat. In terms of Liz's questions and Mika's questions, which I think are similar in terms of the budget, it's essentially what you do when the funder doesn't provide a budget. And I mean, as much as possible, it's good to inquire and get an indicative budget. But sometimes actually the funders may be looking for the most competitive option, in which case it's important to give a solid sort of proposal. But then in terms of just some tips in terms of budget where that hasn't been offered, is think about what would be the minimum that one would do with a certain budget, but as realistic as possible, because what you don't want to happen is to have to dig into your pockets to cover costs that really should have been covered through the budget, or to tap into other project fundings or the centers or organizations co-funding. So really, as much as possible, my advice is always be as realistic as possible within the budget. And perhaps what you can consider is to have different iterations or to cost activities themselves, so that it's clear, okay, if we just do quantitative interviews, this is what it will cost. If we do quantitative interviews plus some in-depth interviews, this is what that will add to this. Apologies for the background noise. And so if you cost activities, then one, you can have that negotiation with whoever is funding you about if I do this component, this is what the total budget will be. If I keep adding different components, this is what the budget looks like. So if you do it that way, then I think you have more room to negotiate with whoever is funding, whether it's a client who's giving you a consultancy contract, the way Mika was saying, or it's a project proposal where you're going perhaps to a particular funder for resources for the work. So the main thing, again, is just to be sure that you're budgeting as comprehensively as possible. And for personnel, think about how much time they would be spending on a particular activity, because then that allows you as well to negotiate and take into consideration even how much time it takes to undertake a particular activity and what it will cost from a personnel perspective. So that's the sort of guidance that I would give. But I don't know, Alpio to Pista, if there's also a session where the webinar can actually just focus on budgeting, because I know even for myself and others, this is a component that one can be quite a challenge. For Francis' question around the objectives and how you want to make sure that each objective is independent, I would say, I think they can, one can build on the other, but perhaps what you don't want is overlap between the objectives. And so in a case where one objective is around developing the study tools and then the other one is actually testing them, it might be in terms of how you frame the objective to undertake formative work to inform the development of a tool as an objective. And so what will that process look like? Will you undertake interviews to understand perhaps community perspective on a certain topic, and then based on that, that is what will then feed into the questionnaire development, and then finally you want to test the validity and reliability and all those other aspects of the tool. So in that case, you can have separate topics, objectives that will build on each other because they are sequential in a sense, but it's very clear that they are still research objectives. So for me, the main thing is that you frame it as a research objective, and I hope that answers your question. For Eric, and I think I saw another question on the chat or Q&A from Kelvin about AI and what are the implications of AI. That's a challenging one because I think we are still so far behind, and I mean we as everybody, in terms of fully understanding the implications of AI. But for me, I would say even when you're writing a proposal, really it should reflect your views and your expertise and your thoughts. You may use AI because AI is also very useful in certain respect. Like you write something down and you say, can you help me say this better? But the ideas are yours. I think for me, that's the most important thing, because ultimately it's you undertaking the research. It really has to be authentically you and showing what you're hoping to study. But of course, AI tools are there. They're helpful in many respects. Even for this presentation, I did use AI. Some of the images that you see are AI generated, just so that I don't get into copyright issues. So I think responsible use of AI is something we need to think about more. And to think about its implication. But for me, I always say for a research proposal, for a publication, let it be your own work. Yeah. Thanks to everyone.
Thank you, Caroline. And yes, we do have a topic upcoming in October on budgeting, so they can look out for that. I will go to the Q&A and see if we have any question addressed to you. Okay, we have a majority on the slides, which will share. How much of a problem is it if I propose to develop a tool in an early work package which is then administered as part of a later work package? That is one. And then, are the regional hubs in place? How can PhD candidates join the hubs? That's for Alpio, will answer. And then some also is requesting for you to share the assurance checklist, which you will do. Where previous data doesn't exist, how do you determine the sample size of respondents? What I have seen people do is do their own mapping and then take that to calculate the scope of their study, or in bracket sample size. And then one last one, there seems to be a high-end technical, this seems to be a high-end technical process. However, at the community level, we have CBOs which are implementing interventions but have no resources for research. How can these communities be assisted to undertake community-led research within their interventions while ensuring validity of the data? I can do one more. Why analytical design is more appropriate than descriptive design. I think I've lost the question. Where has it gone to? Yeah, here it is. Why analytical design is more appropriate than descriptive one? Is there any relationship between design and objectives? Maybe you can answer those, and then we see if we have more time, we can go to the next questions.
Okay. And I hope I'll be able to answer all of them. I think the one on the order of the objectives, I hope in my response to Francis, that did provide clarity in terms of how objectives are ordered and building on each other. And then just in terms of sample size, I am not sure if there is going to be a conversation on sampling, because I do think it's important to get insights on someone who has a lot of experience in sampling. And I guess that's the benefit of working in a research organization where you're bringing on board people with different expertise. But essentially, if that is a challenge in terms of getting someone who can support with the sample size, it's useful. And again, perhaps this is where the internet comes in, because there are quite a number of resources in terms of sampling and even sample size calculators that are available on the website. And they will give you sort of guidance depending on whether the population is known, the population size is known, the population sizes are known, what type of study are you doing? Are you doing a comparative study where you're comparing one group to another? And that sort of thing. And I think that's for me, that would be the advice. If you're in a situation where you're having to come up with these numbers yourself, as much reading as you can, but also use resources online and looking just for even sample size calculators. There are quite a number of good ones, but do make sure it's from a reputable site. So that you're also able to include that in your write-up of your research plan or research protocol. And then in terms of analytical versus descriptive, really in terms of the research objective, you want something that's going to show you depth. It's not just about describing. Does Kenya, for example, have more males and females, or what is the proportion of males and females in Kenya, which is largely descriptive, perhaps not very useful. But you want to go into a depth that shows that this is really worthy of being a research program or study that you're seeking funding for. So that's where the balance is. It doesn't mean that all your questions, research questions or objectives necessarily will be analytical, but as a whole, you want to look at the study, research study itself being an analytical study, not just a descriptive. In terms of the community-led research and what resources they are, I don't know if Alpio or Topista, who are with our research and related capacity strengthening team, can speak more to that. But I can say, as someone who is within our research team, that we have undertaken a number of capacity strengthening activities where we've actually supported community-led organizations to develop proposals for research and worked closely with them. And often that the way that we are sort of imparting that knowledge is partnering with community-led organization, because ultimately, for example, if you're doing interventions work and you're not really looking at the big international non-governmental organization that implement large projects, one of the best approaches is to work with community-led organization or community-based organizations and to partner and collaborate throughout the process. And for me, collaboration really has to be meaningful. It doesn't just mean you come for a few meetings. It's that you really do have a voice in the research, and you find that that's a way that in which research experience is imparted. So working closely together with the community-led organizations is helpful in that respect. Topista, I hope I answered all the questions.
Yes, I will hand over to Alpio to also address the question about the courses. Someone was interested, but I know we've already gotten the first course that began for East Africa. The call was out. Alpio can speak into more about these online courses, and then he can take over from there. Over to you, Alpio.
Yes, thanks a lot, Topista. Yes, as you said, for the courses we have already started the first cohort, but we are also exploring the ways, because we had many requests. We are exploring the ways of running different cohorts concurrently. So we hope that we'll be able to enroll the additional cohorts because of the request that we have had. The demand was very high, so we see if we can enroll many people in the coming months. And then there was also another question about if the regional hubs have already been established. Yes, we have already established the first the East Africa regional cohort, and we are currently working to establish the Western Central Africa satellite station, and then early next year we'll establish the Southern Africa satellite station for this program. Yeah, I think those are the questions that were asked to me.
Yeah, yes.
Okay.
You can take over from here.
Yes. We don't receive many other questions. If we don't receive many other questions, then we can end our today's webinar session here. So, but I see there could be some more questions in the chat.
Yeah, I'm seeing majority want to know where we are going to give the recording. I just said we will share this together with the PowerPoint. This will be shared. Thanks for the great presentation, Dr. Kabiru. There is one here who said, what is the difference? I think this we did. I don't know if we did this. What is the difference between executive summary and abstract? How can we include the quality assurance checklist? This was from Tim Keta, who was not able to ask his question. So Caroline, maybe you can respond to this, and then we can wrap up for the day.
So there was a question about by Berry, whether if it is a good idea to submit a proposal to two different donors at the same time. So I think you can also talk into that, Caroline.
Okay. In terms of the executive summary versus an abstract, I would say an executive summary is almost a short, structured summary of the entire, say, research report, where you're highlighting, giving the background. You're describing the objectives, you're describing some of the key findings and some of the recommendations. And it's often like maybe 1 or 2 pages, and often targeting people who might not have the entire time to read the report so that they have an insight. So you will find many times, especially when we are, for example, targeting people who might not be technical audiences, or people who we know generally might be technical experts but have very limited time. An executive summary is critical so that they have a 2-3 pager that summarizes what the research was about. The abstract tends to be shorter. For those of you I'm sure many of you have submitted research publications, this is something not more than 100, 200 words in many instances. That's very short, succinct. You're not going into the details that you would. And say, for example, if you pick one result to highlight in the results section, then you'll speak to that in the discussion and conclusion of the abstract. So for me, I say an executive summary is a shortened version of the report, of the key highlights of the report, but detailing really all aspects of it for a reader who doesn't have the time to read the report. The abstract is summarizing the work in a way that gives someone a way to assess whether perhaps then this is something that they want to read about. Yeah. Thanks.
Thank you, Caroline.
In terms of the 2 different donors, I would say not. But sometimes it depends, because there are many times that people may be funding for a program of work, and so you're building on different aspects. So it might be a program of work, but there are different aspects, and you're seeking funding from different funders for that work. But it's important to lay out all that so that whoever is receiving knows that this aspect is being considered for a different funder. But the exact same proposal, I wouldn't submit to two different donors. Thanks.
All right. Thank you so much, Caroline. Any last words, any parting shots as we end the meeting?
No, just to thank everyone for all the comments and questions and accolades. I've been seeing the hearts, the claps, really just appreciating everyone and saying that we are here. You can reach out to Alpio or to Pista if you'd like to talk more. Happy to talk more about both your research, but also if there are ways for us to collaborate. Really thanking everyone. And I do wish you success as you seek for funding. And my only advice would be to have a thick skin. It's a hard research. It can be difficult. It can be frustrating. You write an excellent proposal. It doesn't get funded. But just remember that one has to keep the faith and keep going on. And as much as possible, seek to work with others, engage key actors throughout the process. So when you're thinking about research, uptake and communications, don't just share your work at the very end. Think of those that you would find your research valuable and engage them from the very beginning. It just makes for a more powerful way to do research. And also think about the participants or the communities that we work in. When we do research, let's ensure that we meaningfully engage them and that we communicate the findings of our work to them. They've given us information. Let's repay them back by sharing what we've learned through the process. Thank you all, and thank you so much, Alpio and Topista, for the opportunity.
So much, Caroline, also for your time, for the good presentation you've made. And I invite the participants to our May webinar, which will be focused on budgeting. So there was a question about whether we'll talk about budget. It's the next month. Next month we'll focus on budget, and also these webinars we are running them for the first part of 2025, but also we may repeat them for the second part of the year if we find the need. So we keep encouraging you to follow us on and be able to attend this kind of webinars that we are organizing. Thank you so much for your time, and we hope to see you next time.
All right, thank you, and bye everyone.